Hi, I'm Dr. Joseph Militello. I'm a retired general surgeon. I've known Dr. Callahan for 15 years, and I've watched his practice over the years, and I'm very impressed with him. I've been to them several times. My first experience was I had a rare injury to my ankle, and I needed surgery, and I knew that, and I came to Dr. Callahan. He was very upfront and honest with me. He says, you know, I've only done a few of these. I'm not sure you'd be better off seeing someone who's got more experience with this. And he referred me. And I was very impressed with the fact that he cared more about me than he did doing the surgery. I've also had problems with both of my knees. Dr. Callahan has done arthroscopic surgery on both my knees. He had outpatient surgery, and I was very pleased with the results. So when it came time to have my knee replaced, I didn't think of anybody else other than Dr. Callahan. And replacing my knee, being a general surgeon, I knew what can go wrong and what does go wrong, and I was extremely nervous. And to be honest with you, I put it off for 2 years more than I should have. Matter of fact, if I had my knee replaced, I probably wouldn't be retired. I got to the fact is I actually walked in on Dr. Callahan several times to watch him operate to make sure that he knew what he was doing, and I found out he was an excellent technician. I had my knee replaced about 2 years ago, and it changed my life. It wasn't easy going through it, but I was at the point where I couldn't stand, I couldn't wait in line, I could hardly walk. And it was one factor why I retired. After my knee replaced, and after I went through all the rehabilitation, I was able to walk, I was able to exercise, I lost about 50 pounds, and I feel wonderful. In fact, I wonder if I would still be practicing if I felt that way. After the surgery, I had a choice of where to go for physical therapy. And I decided to come to Dr. Callahan's office for physical therapy. And actually, you develop more of a relationship with the physical therapist than you do with the surgeon, because the physical therapy takes several months, and you see them 3 to 5 times a week, where as the doctor, you see him in the office before and after surgery, and for a few minutes in the hospital when you're there. And I thought they did an excellent job on my knee as far as the physical therapy goes, and I was extremely pleased with them. My other experience too, this summer I got MRSA, a staph infection in my elbow, and I went to my old partner, and he aspirated it, took a culture, and just happened to mention it to Dr. Callahan. He called me up that night, and he was on his way out of town. He had a medical meeting scheduled, and he called up his partner, Dr. Simon, and they had me on the surgery schedule the next morning. And Dr. Simon did an outstanding job. What was actually a difficult procedure, and so I was very pleased with him also. They're very professional, and like I say, I've observed them over a period of 15 years, and I'd recommend my family. I'm sad to say, because of my age, my other knee is starting to go, and there's no question who's going to do it.